if your child is having difficulties in school, it may not actually be related to their ability to learn or any behavioral issues. It could actually be their eyesight. And today we're joined by two more optometrists from eyehealthdoctors.com, Dr. Lil Vogel and Dr. Alita Gong, to talk a little bit more about this. Thanks so much for being on the show. We appreciate you being here.
Thank you.
Thank you.
It's a topic that's near and dear to my heart because I have a 6-year-old and we're getting to that place where we're thinking, okay, is it a reading problem or is it a vision problem? So let's talk in the next couple of minutes about optometric vision therapy.
Well, thank you. And we were going to talk about optometric vision therapy, but first let me tell you, Stephanie, why I got involved in vision therapy. When I was in 2nd grade growing up here in Phoenix, my reading teacher told my parents that I would never amount to anything. Even though they were devastated, they did take me to a doctor who specialized in vision therapy in 3rd grade. He prescribed vision therapy and glasses, and in 4th grade ended up testing into a gifted program at that same school.
And it was all because of that vision therapy intervention, I would imagine.
Yes, and at that time I knew in my heart this is what I wanted to do for a living, and I could speak for most optometrists. They have a passion for their patients and for any of their visual needs.
So how does this therapy, this optometric vision therapy work? As a parent, what can I expect my child to go through?
Well, we have an individualized program where we treat the patient's visual needs. So as we do the exam and we get the diagnosis, we find out why is the children so shutting off an eye, not tracking, not being able to change focus, not being able to process what they see. We can even work with patients that have had traumatic brain injury. Visual rehabilitation is a multidisciplinary effort. We work with neurologists, psychologists, psychiatrists, occupational therapists, physical therapists, all
Sounds like
types
there's
of
a
people.
multitude of ways to address a vision problem that, in your case, was misdiagnosed as, you know, but really kind of described as a problem with your abilities. As a parent, though, what specifically are we looking for in terms of signs and symptoms that would indicate that there's a vision problem?
Well, that's a great question. I get that question a lot. The child might avoid doing a lot of near work, have blurred distance or near vision, have dizziness, double vision, difficulty tracking, frequent visually related headaches, misalignment of their eyes, poor depth perception, may even shut one eye, and in school they may lose their place when they're reading or have poor reading comprehension. Also word or letter reversals too.
Okay, so I can see that as a parent you're really going to have to be acutely aware of the level that your child is reading at and also combine that with the symptoms and see how they match up. But I would guess that there's cases with children who they get distracted because they're not having success and they're frustrated with the ability to see and consequently are you know, categorized as ADD or ADHD when in fact they may not even be.
You're absolutely right, Stephanie. There is a recent study from the University of San Diego that found that children with a simple vision disorder called convergence insufficiency, which is the inability to align the eyes inward for long periods of time, are 3 times more likely to be associated with ADD and ADHD.
Wow. Well, that's significant. I got to get back to those video games, though, because I've got a boy, and he's always wanting to play those video games. But then sometimes I wonder, am I you know, doing a disservice to him? Is it harming his vision to be playing those 3D games or these, you know, high activity, you know, a lot of stimulation on the eyes? Is that harmful to eyes?
Well, we do know that we're finding 3D more in our society. It could be in movies, television, mobile devices in the classroom. They're finding out that it actually helps kids concentrate and perform better on tests by about 17% when they are involved in 3D. But if your child can't do 3D, then they may report dizziness, discomfort, or a lack of 3D. And that's very important because if they have any of those 3 symptoms, then they need to be checked by their optometrist. You have to be able to align the eyes and be able to sustain focus in order to see in 3D. Now, the American Optometric Association has quoted that there is no evidence that 3D or viewing 3D has any harmful effects on children, and that actually for the 1 in 4 that have underlying problems with their vision and millions of adults, this actually is a good thing. If you have a lack of 3D, it will identify those problems and get them going to see their eye doctor.
Well, I think we've just scratched the surface, and obviously treatment options is really the next step for most parents as they start to perhaps identify a couple symptoms that we've discussed here in the last couple of minutes. So if you'd like to take the next step and learn a little bit more about your options, please call 877-867-9268 or visit eyehealthdoctors.com to find a location near you and to find out more. And you can find Dr. Alita Gong in North Phoenix at 35th Avenue between Greenway and Bell Roads. The address right there on your screen. And Dr. Lil Vogel is located at 107th Avenue in McDowell and Avondale, and you can get a hold of both of them through the quick and easy eyehealthdoctors.com.